Hello everyone, Rubik here.
And I'm Andre.
Welcome to our 10th web series. And as you can see, we're filming today from our technical part of our office, where this is where all the magic happens. And me and Andre decided to pick a topic today that is kind of fun, visual, and educational, of course. And today we decided to talk about, to see what same body part looks on different modalities. For instance, X-rays, MRI, CT, and on ultrasound.
Yeah, we actually decided to pick a body part that, all the modalities get a lot of orders for. And we chose an abdomen because the abdomen is ordered for an X-ray, for an ultrasound, for a CT, and for an MRI. The purpose for today is to actually show you guys what those images look like, and when is one, preferred over the other. What do we look for when we look at these images? We'll keep it very light, very visual, just so you guys can have an idea whenever you see an image from an ultrasound or from an X-ray. So we'll do 4 modalities. We'll do X-ray, ultrasound, CAT scan, and MRI in that order. And I'll ask Rubik to get started with an X-ray and an ultrasound, and then I'll finish it up with the CT and MR.
As we said previously, we're going to start with an abdomen X-ray, which is also known as KUB, kidney, ureter, and bladder. And as you can see in this picture, it can be done either standing up, or laying down. And it's either 1 shot or 2 shots. And here we see the frontal shot. And it's very informative. It shows basically they want to do this to rule out any kind of stones, kidney stones, bladder stones, or stones that are stuck in a ureter. And also it's done to see fluid levels and if there's any kind of bowel obstructions. It gives you, it's like I said, KUB stands for kidney, ureter, and bladder. Now we're gonna move on to ultrasound. I'm just gonna open up the next study for you guys. Here we go. It's an ultrasound of an abdomen. Initially, when we heard ultrasound, we always thought about pregnancy issues and only was done for pregnancies. But technology has advanced so much that now it's done. Last 20 years, they use ultrasound as a perfect tool for any kind of diagnosis for any part of the body. Ultrasound uses sound waves, which goes through and gets an image of, goes through the body and gets an image of a solid organ. Soft organs, which are intestines or lung, it's not diagnostic for ultrasound. But for ultrasound, it's the liver, mainly abdomen part, liver, kidneys, gallbladder. Right here in this picture, we see the liver and pancreas in this shot. And whenever we see this dark area, a lot of patients see this dark area, and it raises questions. But that's the gallbladder. So, ultrasound is done in 2 different planes: sagittal or transverse, or horizontal and vertical. And it's one of the initial tools to start basically diagnosis, and it's a good startup to rule out anything, and it's an initial modality before they get to CTs, MRs, or X-rays to rule out any kind of abdominal abnormalities. And now I'm going to have Andre tell us about abdominal MRIs and abdominal CAT scans or abdominal CTs.
As you saw earlier, Rubik showed you images of an X-ray and an ultrasound and what an abdomen looks like with those modalities. We want to take it a little bit further, a little more into detail, a little more sophisticated studies into a CT and an abdomen. Before I show you some CAT scan images, I wanted to tell you that CT of the abdomen is probably the most frequently ordered exam because of its clarity of the different organs and the accuracy of its diagnosis. CAT scan of the abdomen is ordered very frequently. And you will hear that it's, the study is done, sometimes we drink that chalk fluid, which is called barium, or it's done with an IV injection, or it's done both together. The oral part you drink, it's for the digestive organs, the stomach, the colon, the intestines and all that. And the IV injection is used for to determine any vascular issues, or if you're suspecting cancer, mass, and all that stuff. So let's come on over here and take a look at some images. As you saw, the X-ray only had one image to look at. CAT scan is basically a 3D X-ray, and if you can imagine, we take the abdomen and we slice it into, if you picture a loaf of bread, every 5 or 10 millimeters, we take a picture. And I'm just going to scroll down and point on some anatomy. Here we started from just above the liver, and we're going to work our way down. This bright area that you see is the patient's heart. Coming down here, look how beautiful the liver looks. This is the stomach, and the white shades that you see, that's the barium that the patient drank. This is the spleen right over here. Coming down, look how beautiful the kidneys look. All the white areas that you see, that's the oral contrast that the patient drank, and it coats the walls of the colon, and we're able to see if there's any abnormalities and such. And the IV, you will notice here, you see these two little threads that go into each kidney. Those are the blood supplies into your kidneys. We can also tell if there's any narrowing of those vessels, or if there's something going on which is depriving the blood to go into the kidneys. And thereon, as you can see, there's about maybe 80 to 100 images throughout the abdomen. And what happens is the difference between an X-ray and a CT, like I said, with the way the technology has gone, we're able to scan in transverse plane like this, but we're also, after the patient is gone, of course, are able to turn the picture from different directions. Like we can look from the side here, is if I was looking at the patient's abdomen from a side view. Again, here's the kidney, here's the stomach. Why this is important is, let's say there's a lesion or a mass, you'll know exactly if it's at the front or the back of a certain organ. You can do better measurements from this angle. And as you can see how clear and beautiful the images are, differentiating from one body part to the other. Here you have the bladder sitting in the bottom here, this now right, oval shaped. And you can also see a beautiful spine over here. As you can see, one of the bones right here looks compressly fractured. So this is abdomen, CT of the abdomen. And as I said, it's a very common exam, and it's a very accurate exam. And pretty much all that you want to diagnose, you're able to tell from just doing a simple CAT scan of the abdomen. And that's for the CT. I'm going to pull up the MRI study here. All right. As you can see here, we have many more sequences than even a CAT scan. So when the study leads up to an MRI, at this point, the only reason they pretty much do an MRI of the abdomen, if let's say there's something on the CT or an ultrasound, they're unable to tell what it is, it's inconclusive. They need a little bit more information as to what type of a lesion that is, or exactly where it is. The MRI, the good thing is, we can specifically do a sequence to look at the fat. We can specifically look at the sequence to look at the soft tissue, and also we're able to spin the patient into whichever direction we want to be able to take the picture, and that's the advantage of the MRI. MRI of the abdomen is rarely done for screening purposes, so usually something is going on when you go into an MR and you try to pinpoint exactly what that is. I'm just going to show you some images so you see what the MRI looks like. Very similar to a CAT scan, except it doesn't, you can see a lot more color difference. It's not as grainy, it's not as gray from one body part to the other. Look at the structure of the liver, how beautiful it looks. You can see every little detail in the liver. MRI, the only thing it's not good for is the areas that contain air. That would be the colon or the lung. So hardly ever an MRI is ordered for those purposes. I'll go down a little bit more, show you a couple more images here that we have the kidneys coming in. Here's the gallbladder nice and bright. So when you do an MRI, you know, one sequence looks at fluid, like I said, one sequence looks at the bone better, the other one looks at fluid better, and that's the advantage of the MRI. It does take a little bit longer than the other modalities, but it does give you more information as well. And, you know, along with ultrasound, MRI is very non-invasive. It doesn't have radiation, you know, your body's not being harmed by having these studies. So let me show you a few more angles of this here that we're looking at the same body part from a side angle, looking at it from the sideways. Again, we're able to tell exactly where the anatomy is and if there's any abnormalities, exactly where it is relative to the other organs. Here's another view, front view. Make it a little bit nicer for you guys to see. I'm hoping that the quality is good. You know, you can see the kidneys on each side. And when you're looking at an X-ray or a radiology image, always remember it's like you're looking into the mirror. So this side would be the patient's right side and this side would be the patient's left side. A lot of times I'll have a patient running in and saying, I thought they said it's my left side, but it's on the right side. But when you're looking at the image, imagine if you're looking at like a mirror, you know, you're standing in front and this would be the right side and this would be the left side. Let me show you a couple of more images for an MRI. Here, this is called an MRCP. This is a really cool study to do, which no other modality is able to do. In this case, they're concerned only about the common bile duct. It's the duct that goes into the liver and into the pancreas and all the other organs, and we're able to see if there's anything going on in that duct, from calcium to, you know, narrowing. As you can see, all the tissue around it has been blocked out, and all you can see is that beautiful common bile duct. So I hope, you know, we helped by showing you some, you know, images. You know, we didn't get into a lot of detail. We'll leave that stuff to the radiologist, but now you'll be able to tell, you know, if it's an MRI image or an X-ray image or a CT image. And with that, we'll conclude our technical portion of this part.
Well, we hope it was as visual and as fun as we promised. And hopefully next time when you see an image of an abdomen, you will know if it's an X-ray, MRI, CT, or an ultrasound.
Or just in general, what an MRI.
Just in general.
Right. If you guys have further questions or more into detail regarding what we just covered today, please feel free to send a comment, email, or you know, from the different social media platforms that we are. And please continue to follow us. We promise to get you more educational information in this beautiful field we call radiology. Have a good one.